parents out there struggle with your children's diet. Okay, I know as a parent, it's a constant battle, balancing out the proteins and the carbohydrates, and we'll eat vegetables and getting them to eat, you know, how far do you take? Well, today, Maria is here with us. She is a naturopathic doctor, and she's going to help shed some light on, you know, how strict we really need to be as parents on all this. Hi, Maria.
Thank you for having me. So when it comes to proteins, carbs, and fats, I mean, a lot of kids get the carbs. You know, they get the breads, they get the fish crackers, they get all of that. When it comes to proteins, I think we need to even focus beyond just the meat. So a lot of kids actually don't like to eat chicken or even some of the beef or pork, but it's branching away from that as well. So focusing even on nuts or nut butters like almond butter, peanut butter, a lot of beans, things like that, okay? And then when it comes to fat, I mean, a lot of kids do have a lot of fat in the diet. However, it's choosing the good fats. So it's sticking more with the omega-3 fatty acids, you know, the fish oils. Again, going more towards avocados, olives, nut butters. Those are going to have the really good healthy fats that the kids need to support brain function and neurological development. Because the brain is mainly made up of fat, especially under 2 years of age.
Okay, yeah. So talk to us a little bit. We've got some good stuff in here.
Yes.
So what are these guys?
Okay, so my top 3 things to suggest to kids. So, you know, when a child patient does come in, I do recommend 3 essential things. So the first thing would be a good probiotic. So I just brought in 2 as an example because you can have a powder formula, or now they even have like the chewable formulas as well. So, you know, it's good. The powder is good for younger kids, but the chewables are greater for the older kids.
Right, so this is the powder one.
Yes, that's the powder one.
And then those are the
chewables, exactly. Yeah, so it's great for immune function, supporting digestive health, and the brain and the gut have a major connection. So improving gut function, you improve brain function.
Okay, and then moving on to the next 2.
Yes, so those are fish oils. So again, getting back to those omega-3 fatty acids, that are quite essential for brain and neurological function. So one is a liquid formula. So some kids like it because it's berry flavored. Yeah, so they really enjoy it. So it's very thick and syrupy, so they kind of like it. And then you have more of the chewable soft gel. So those they just chew, and it gives them the fish oil that they need. So again, neurological functioning as well. I mean, new studies have just come out that children who do have omega-3 fatty acids in their diet have greater reading potential and better memory. So, you know, those omega-3s are quite essential.
Okay. That's fantastic. And then we've got this little bottle.
Yeah, so the vitamin D. I mean, all kids are usually on vitamin D. You know, as soon as they're born, they're put on at least 400 international units of vitamin D. Yes. But you can slowly increase, you know, especially after they're 1 year of age. But again, it's showing huge improvement with neurological brain development. It's reducing risk of cardiovascular disease and other chronic diseases. So there's so many huge benefits with vitamin D. And we are deficient in our society. I think about 1/3 of our population is quite deficient.
That's amazing.
That's amazing. So children should always be on vitamin D.
Should always be on it.
Up until what age would you say?
Honestly, I would just continue it. Like, especially a lot of kids now, especially when they get into those age 10, 11, 12, they're more with the Nintendo or the video games, so they're not outside as much. So it's getting them outside. You know, during the summer, they can always take a break on the vitamin D if they are. But starting from October till now, till about, you know, April, March time, you definitely want to be on the vitamin D.
Just a side note, I read in some magazine, I think it was last year, that to get the proper amount of intake of vitamin D naturally, you have to literally lie naked under the sun for like 3 hours.
Yeah. Well, they do recommend, you know, if you are going to be out in the sun, to actually be out for a good 20 minutes without without sunblock, so you get the pure sun exposure, and that will give you a sufficient amount of vitamin D. But you know, we put a whole bunch of sunblock as soon as the child's outside, so it prevents that production as well.
Oh, I see.
Yes.
Yeah. Well, that's really good to know, because my children, I mean, they're, you know, 5 and 8, I don't give them vitamin D anymore.
Yeah.
And it's important.
But it's also important to test them. Like, you know, it's very simple tests that you can do. I mean, there's blood spot tests. There's blood tests you can do through your medical doctor as a blood draw. And then those are easy to rule in or rule out as whether they are actually deficient in their blood or not.
Okay, so talk to us a little bit about this testing.
Yeah, so, I mean, we have food sensitivity testings that are available through naturopathic doctors. And by doing this, then you can discover the child's food sensitivity. So, you know, a lot of people come in and say, well, my child gets very hyper on sugar. Well, they might just get naturally hyper on sugar because it produces adrenaline and they get hyper, but they can also be sensitive to sugar. So it's finding out that degree of sensitivity. Okay. So on an immune level, we do have two reactions to food. So one is called an IgE reaction, which is very immediate. So for example, you drink milk and right away, you know, the child's in the washroom having diarrhea or something.
Yeah.
So it's very immediate. But as a naturopathic doctor, we're interested in more of an IgG reaction, which is a delayed reaction. So it's a sensitivity over 48 hours. Okay. So for example, they would drink milk and maybe not have a reaction till tonight, tomorrow, even after tomorrow. So it takes those couple of days to manifest, whether it's in skin rashes, fatigue, you know, behavioral issues, even digestive concerns. Any one of those symptoms could be presented as a concern for food sensitivities.
And up to 48 hours.
Up to 48 hours.
You know, I've always sort of watched immediately. I didn't realize that 2 days later I might see. That's harder to track.
It is harder to track, and that's why, you know, when, as a baby, when you're introducing foods, they say introduce one food every, you know, 3 or 4 days, and that's why, because the reaction can take those 2 to 3 days to manifest.
Oh, okay. That's good to know.
Yeah,
good to know. But it also makes it more challenging. So just being watchful.
It does.
Absolutely.
Yes.
But anyhow, so just one quick question, and we don't have a lot of time. Is the asthma and the eczema that they go hand in hand, and the first thing that they always say is get them off dairy.
Exactly.
So tell us a little bit about that quickly, about 1 minute.
Yeah, it's about, again, finding the sensitivity. So it may be dairy for one child, but it may be gluten, eggs, it could even be yeast for another child. So again, it's finding out what the sensitivity is, then removing those particular foods because it can benefit skin function. But by suppressing eczema, then you can develop asthma further down the line. And we've seen this over and over again manifest because the disease hasn't gone away, it's just been suppressed. So that needs to come out, and it will come out as asthma a few years down the line. So it's always, the key message is to discover the food sensitivities and find those out early.
Oh, wow.
Maria, thank you so much for being here.
Fantastic.
So much information.
Yeah, that's great. Thank you very much.
Thank you again for being here. And now, well, I think we're getting ready for Houston. We have a problem, right?
Yes.